the first caution is to not think of all the antibody-drug conjugates as a class in terms of side effects. They're really quite unique drugs. So sacituzumab govitecan has a very different side effect profile with low counts and diarrhea compared to trastuzumab deruxtecan, where we really have to worry about nausea and then the possibility of ILD. I think you're right. There was concern when trastuzumab deruxtecan was first coming out around, fatal cases of ILD and the frequency. We know that 10 to 15% of patients that receive trastuzumab deruxtecan will have some grade of ILD. Luckily, with increased monitoring and recommendations, we've really been able to all but eliminate those fatal cases. So our biggest side effect day to day for trastuzumab deruxtecan is really nausea. And we have to remember that when these trials were going on, mandatory antiemetics were not required. This is recommended by NCCN, ESMO, ASCO guidelines now for at least a 2, if not a 3-drug antiemetic, a prophylactic regimen. So upfront, before anyone has any symptoms. And for my patients, this is really working quite well in the clinic. It's very rare that people have any significant nausea after this regimen. And if they do, I find that olanzapine at night works really well for those patients.